Good morning, everybody. Thank you so much for being here. Before we begin, I'd like you to do something for me. If you're comfortable, I'd like you to close your eyes for a moment, and I want you to picture a child. Maybe it's your son, maybe it's your daughter, maybe it's a grandchild, or a child that you care for. Picture their face, picture their smile, picture the things that make them uniquely them. Their strengths, their quirks, the things that make them special. Now, I'd like you to think about something that child worries about. Perhaps it's school, or friendships. Perhaps it's sleeping alone or making mistakes. Maybe it's trying something new, or being away from you. Maybe it's getting things wrong, or perhaps they worry about things that seem difficult to understand. Now, picture what anxiety looks like in your child. Perhaps they ask endless questions, or avoid things. Perhaps they become angry, or maybe they cry. Perhaps they show it by complaining of tummy aches or clinging to you. Perhaps they seem perfectly fine at school and then fall apart at home. Keep that child in your mind throughout today's talk, because that child is why we're here. Not because they're difficult, not because they're manipulative, not because they're attention-seeking, but because they're worried, and because we want them to thrive. Now, if you're closing your eyes, you can open them now. Now, let me know in the chat how many people here have ever looked at your child's worries and thought, why are they worrying about this so much? Let me know in the chat how many people have ever accidentally reassured your child for the 20th time and found yourself thinking, we've had this conversation already. And let me know in the chat how many people have ever wished you could simply take your child's worries away. Thank you. You are certainly not alone. And if we haven't met before, my name is Dr. Harry Woodward. I'm a consultant paediatrician, and I help children with ADHD and autism and their families to thrive. And over the years, I've met thousands of families, and one of the commonest things parents say to me is, Doctor, my child worries about everything. Or she's always asking what if. He won't try anything new. And many parents quietly wonder, am I making things worse? I want to reassure you, you're probably doing a better job than you think. As a parent, I've certainly found anxiety one of the hardest things to navigate. Because when our children are worried, our instinct is to protect them, to rescue them, to make the worry disappear. And that instinct comes from love. But today, I want to convince you of something important. Anxiety is not the enemy. Anxiety is part of being human. Our goal is not to eliminate anxiety. Our goal is to help children cope with it. Because understanding changes everything, and that is what today's talk is all about. We're talking about the fifth spoke in the Confidence Wheel series, Anxiety and Worry. The Confidence Wheel is the framework I use with families to cover all of the areas of family life that often feel difficult and are interconnected. And anxiety is not just one thing, it is many things. And today I'm going to break it down for you one step at a time. So the first spoke in the Anxiety and Worry Confidence Wheel is understanding anxiety. So why does anxiety matter so much? Because anxiety affects almost every aspect of a child's life. It affects sleep. It affects learning. It affects friendships. It affects emotional regulation. It affects family life. And ultimately, it affects confidence. I sometimes think of anxiety as being like an oversensitive smoke alarm. The purpose of a smoke alarm is to keep us safe. If there is a real fire, we want the alarm to sound. The problem comes when the smoke alarm starts going off every time somebody makes toast. Many anxious children have wonderfully sensitive brains that are constantly scanning the environment for danger, for threat, for uncertainty, for things that might go wrong. And whilst that system exists to protect us, it can sometimes become a little overprotective. So let me know in the chat how many people here have ever found themselves worrying about something that never actually happened. Yes, all of us, because anxiety is part of being human. Now imagine being 8 years old, having a wonderfully imaginative brain, feeling emotions intensely, perhaps struggling with uncertainty, perhaps finding change difficult, perhaps already feeling different from other children. It's hardly surprising that anxiety is common in neurodivergent children. I remember meeting one young person whose parents described him as worrying about everything: school, friendships, sleeping, the weather, illness, the future, everything. The family had started to feel frustrated. They couldn't understand why reassurance never seemed to work. As we explored things together, it became clear that this child wasn't choosing to worry. His brain was trying very hard to keep him safe. The difficulty was that the alarm system had become overactive. Once the family understood this, everything changed. There was less frustration, less reassurance, more understanding, more support, and the parents said something that has stayed with me. They said, "For the first time, I realized my child wasn't trying to make life difficult. He was trying to feel safe." I think that sentence captures anxiety beautifully. Anxiety is not attention seeking. It is safety seeking. And when we understand that, we begin to respond very differently, with curiosity, with compassion, and with support. Because behaviour that looks difficult often makes perfect sense once we understand what the brain is trying to protect. I think becoming a parent has taught me something important. When our children are anxious, our instinct is often to remove the anxiety, to rescue, to reassure, to protect. And those instincts come from love. I know they certainly do for me. But one of the most important lessons I've learned is this: our job is not to eliminate anxiety. Our job is to help children become confident in their ability to cope with it, because confidence does not grow when children never feel anxious. Confidence grows when children discover, I can do hard things. So if I could leave you with one message from this section, it would be this: anxiety is not attention seeking, it is safety seeking. So, if anxiety affects so many aspects of family life, where do we begin? Just like sleep and emotional regulation, I believe, using the confidence wheel framework, that anxiety is not one thing, it's many things. And that brings us to spoke number 2 on the anxiety and worry confidence wheel. So let's move on to spoke number 2 on the anxiety and worry confidence wheel, triggers and uncertainty. Because anxiety rarely appears out of nowhere. Very often there are triggers, and understanding those triggers is one of the most powerful things families can do. So let me know in the chat now how many people here have ever thought that worry seemed to come completely out of nowhere. Yes, most of us have had that thought. I remember meeting one young person who became extremely anxious every Sunday evening. There were tears, tummy aches, difficulty sleeping, arguments. The family couldn't understand it. Nothing bad was happening. School was going reasonably well. So why every Sunday? As we explored things further, something became clear. Sunday evening represented uncertainty. What lessons would there be tomorrow? Who would they sit next to? Would there be supply teachers? Would plans change? Would they get something wrong? The anxiety wasn't random, it made perfect sense. I think uncertainty is one of the biggest drivers of anxiety in neurodivergent children, because uncertainty means I don't know what will happen. And for anxious brains, not knowing can feel very unsafe. Many children find uncertainty difficult, but for some neurodivergent children, uncertainty can feel almost unbearable. Unexpected changes, changes in routine, last-minute alterations, new situations, new people, unclear expectations, all of these can trigger significant anxiety. I suspect many parents here recognise questions such as, what are we doing tomorrow? Who will be there? What time are we leaving? What if the plan changes? Again, you're not alone. I sometimes say that predictability is calming, uncertainty is activating, and this is why preparation can be so helpful. Not because we can remove all uncertainty from life, we can't, but because we can reduce unnecessary uncertainty. Practical strategies might include talking through plans in advance, using visual schedules, giving warnings before transitions, preparing for changes whenever possible, explaining what to expect, and, perhaps most importantly, acknowledging uncertainty. Sometimes we rush to reassurance. Don't worry, it'll be fine. But anxious children often need something different. They need understanding. For example, I can see you're worried about tomorrow. It makes sense that this feels hard. We don't know exactly what will happen, but we'll work it out together. I think becoming a parent has taught me just how tempting reassurance can be. When our children are worried, we want to make the worry disappear. I certainly do. But over time, I've realised that confidence grows not when children avoid uncertainty, but when they experience uncertainty and discover, I coped. And that is a profoundly important lesson. So if I could leave you with one message from this section, it would be this. Predictability is calming, uncertainty is activating, and understanding triggers helps us move from reacting to preparing. Which brings us to our next spoke, physical symptoms. So let's now move on to the third spoke on the anxiety and worry confidence wheel, physical symptoms. Because one of the things that surprises many parents is that anxiety is not just something we think. Anxiety is something we feel. And very often children experience anxiety in their bodies long before they recognize it as anxiety. Let me know in the chat how many people here have ever felt anxious and noticed physical symptoms. A racing heart, butterflies in your stomach, sweaty palms, feeling sick, difficulty sleeping. Yes, most of us have. Because anxiety is not just an emotion, it's a whole body experience. Now imagine you're 8 years old. Your heart is racing. Your tummy hurts. You feel sick. Your muscles feel tense. You feel shaky. But you don't understand why. That can be frightening. I remember meeting one young person who was missing large amounts of school because of severe tummy aches. The family had understandably become very worried. Multiple medical assessments had been performed and the tests were normal. Nobody could find a physical explanation. As we explored things further, a pattern emerged. The tummy aches were worst on school mornings, particularly on days involving PE, presentations or changes to routine. The tummy aches were real. The pain was real, but the underlying driver was anxiety. I think this is enormously important because anxiety symptoms are real. Children are not making them up. They're not pretending. They're not attention seeking. Anxiety can cause tummy aches, headaches, nausea, dizziness, a racing heart or chest discomfort, muscle tension like the body's braced for danger, difficulty sleeping or staying asleep or settling, appetite change, either eating more or less than usual, and frequent visits to the toilet, especially before events. And sometimes children don't say, "I'm anxious." Instead, they say, "My tummy hurts. I don't feel well. I don't want to go." I think one of the most helpful things we can do is help children make the connection between emotions and bodily sensations. For example, "I wonder if those butterflies in your tummy might be worry. I notice your shoulders look very tense. I wonder if your body is telling us something." Because once children begin to understand their body's signals, those sensations often become much less frightening. I often explain anxiety using the analogy of a smoke alarm. Remember what we said earlier? The body is trying to protect us. The difficulty is that sometimes the alarm system becomes oversensitive. The alarm goes off, even when there is no real danger. Understanding this can be incredibly reassuring, because when children understand this is anxiety, this feeling will pass, my body is trying to protect me, they often begin to feel less frightened by the symptoms themselves. And that matters because fear of physical symptoms can sometimes make anxiety even bigger. So if I could leave you with one message from this section, it would be this. Anxiety is not just experienced in the mind, it is experienced in the body. And helping children understand their body's signals is one of the first steps towards building confidence. Which brings us to our next spoke, avoidance and safety behaviours. I think this may be one of the most important sections of today's talk, because anxiety has a very clever trick. Whenever something feels frightening, anxiety tells us avoid it. And in the short term, avoidance works brilliantly. Let me know in the chat how many people here have ever avoided doing something because it made you anxious. Perhaps it was making a difficult phone call, speaking in public, or going somewhere unfamiliar. Perhaps it was having a difficult conversation. Let us know in the chat. Most of us have avoided something because it made us feel anxious, because avoidance is human. I know this myself. Many years ago, before giving talks became a regular part of my job, I used to feel incredibly anxious before speaking in public. And there were moments when cancelling and staying at home felt very attractive, because avoidance immediately makes us feel better. The problem is that whilst avoidance reduces anxiety in the short term, it often makes anxiety bigger in the long term. I remember meeting one young person who became anxious about attending school after experiencing some friendship difficulties. Initially, the family agreed that one day off might help, and it did. The child felt better, and everybody felt relieved. But the next day felt harder, and the day after that, harder still. Soon, school attendance became almost impossible. So what had happened? The anxiety had learned something. If I avoid school, I feel safer. Every avoidance sends a powerful message. This must be dangerous. And the next time we encounter that situation, anxiety often becomes even bigger. I often explain this to families by imagining anxiety as a playground bully. The more we back away, the bigger the bully becomes. The more we gradually face our fears, the smaller the bully becomes. Now, please don't misunderstand me. I'm not suggesting that we throw children in at the deep end. I'm not suggesting we say, just get on with it, face your fears, or toughen up. Because confidence rarely grows through overwhelming children. Confidence grows through supported experiences. One small step, then another, then another. I sometimes call this climbing the confidence ladder. Rather than expecting children to immediately do the hardest thing, we ask, what is the smallest step possible? For example, if a child is anxious about sleeping independently, the steps might look like this. Sitting in their bedroom together, then sitting further away, then briefly leaving the room, then gradually increasing independence. Small steps matter because every successful experience teaches the brain something new. I was worried. I did it. I coped. Alongside avoidance, many anxious children develop what we call safety behaviours. These are the things children do to help themselves feel safe. For example, repeated reassurance seeking, wanting parents nearby, checking, avoiding mistakes, carrying comfort objects, needing routines to happen in very specific ways. Safety behaviours make perfect sense. They exist because children are trying to feel safe. But sometimes, if we become overly reliant on them, they can unintentionally maintain anxiety. I think one of the hardest parts of parenting an anxious child is knowing when to provide comfort and when to gently encourage bravery. And if I'm honest, I still find this difficult. Because when our children are distressed, our instinct is to rescue. That instinct comes from love. But confidence grows when children discover I can do hard things. So if I could leave you with one message from this section, it would be this. Avoidance brings short-term relief, but long-term restriction. And confidence grows through supported experiences, not avoidance. Which brings us to our next spoke, worry loops and reassurance seeking. So let's move on to spoke number 5 of the anxiety and worry confidence wheel, worry loops and reassurance seeking. I think this may be one of the most challenging aspects of anxiety for families, because when children are anxious, they often ask questions, lots of questions, the same questions again and again and again. Let me know in the chat how many people here have ever answered the same anxious question 10 times in a single day. Yes, I thought so. Questions such as, are you sure I'll be okay? What if something bad happens? Are you definitely coming back? What if I get it wrong? What if I can't do it? Will you stay with me? And as parents, our instinct is obvious. We reassure, of course we do, because we love our children. And when our children are distressed, we want to make that distress disappear. I know I certainly do. There is something incredibly powerful about seeing your child upset and being able to make it better. The difficulty is that reassurance often works brilliantly in the short term. A child asks, will everything be okay? We say, yes, of course it will. And everybody feels better for a while. But then an hour later, the question returns, or perhaps 10 minutes later. And before long, families can find themselves trapped in what I call a worry loop. This is what's going on. The child feels anxious. They seek reassurance. The parent reassures. The anxiety falls. Then the anxiety returns. The child seeks reassurance again. The problem is that the brain never learns I can cope with uncertainty. Instead, it learns I can only cope when somebody reassures me. Now, please don't misunderstand me. I'm not suggesting that we should never reassure children. Children need comfort. Children need empathy. Children need to know that we are alongside them. But sometimes, rather than repeatedly answering the worry, we can help children become curious about it. For example, instead of saying, nothing bad will happen, we might say, that's a worry. What does your worry brain think might happen? What does your thinking brain think? Or, have you managed difficult things before? What helped last time? I sometimes talk to children about having 2 brains, a worry brain and a thinking brain. The worry brain's job is to spot danger. The thinking brain's job is to weigh up the evidence, because anxious brains often overestimate danger and underestimate coping. Our job is to help children remember I can cope. I remember one young person who asked their parents dozens of questions every evening about the following school day. Initially, the family answered every single question, but over time, they began gently redirecting some of those questions back to the child. What do you think? How did you cope last time? What would you say to a friend? Gradually, something changed. The child became less dependent on reassurance, and more confident in their own ability to cope. And that, ultimately, is our goal, not to become our children's permanent reassurance system, but to help children become confident in themselves. I think this is one of the hardest balancing acts in parenting, because reassurance feels loving, and it often is, but confidence grows when children discover I can tolerate uncertainty, I can cope. So if I could leave you with one message from this section, it would be this. The goal is not to eliminate uncertainty. The goal is to help children become confident in their ability to cope with uncertainty, because confidence grows when children discover I can do hard things. Which brings us to our next spoke, ADHD and autism differences. Now, I think this section is incredibly important because whilst anxiety affects all children, anxiety can look a little different in neurodivergent children. And unless we understand those differences, it can be very easy to misunderstand what children are telling us. So let me know in the chat how many people here have ever looked at your child's behaviour and thought, that seems like a very big reaction. Yes, many parents recognise that. We know that anxiety is significantly more common in children with ADHD and autism. In fact, for many children, anxiety is one of the biggest challenges they face. But the anxiety does not always look the way we expect. When we think about anxiety, we often picture a child who looks worried, quiet, nervous, clingy, but anxiety can wear many disguises. Sometimes anxiety looks like anger. Sometimes it looks like avoidance. Sometimes it looks like perfectionism. Sometimes it looks like school refusal. And sometimes it looks like complete emotional exhaustion. Let's start with ADHD. Many children with ADHD experience emotions intensely. Emotions can arrive quickly, feel overwhelming, and take longer to settle. Many children also experience what is sometimes called rejection sensitivity. This means that criticism, mistakes, friendship difficulties, or perceived rejection can feel incredibly painful. I remember meeting one young person who became absolutely devastated after a teacher corrected a piece of work. The correction was gentle, kind, entirely appropriate, but the young person interpreted it as, I've failed, I'm stupid, my teacher doesn't like me. Understanding this changed everything. The adults around the child stopped seeing overreaction and started seeing vulnerability. Many autistic children experience anxiety for slightly different reasons. Uncertainty, unexpected change, sensory experiences, social situations, unclear expectations, all of these can create significant anxiety. I suspect many people in this room recognise questions such as, what exactly is going to happen? Who will be there? How long will it last? Where will we sit? Predictability matters enormously because uncertainty often feels unsafe. Many autistic children also work incredibly hard to mask. They observe, copy, suppress emotions, hide confusion, try to fit in. And whilst masking can sometimes help children cope socially, it often comes at a cost. Masking is exhausting, which is why many children appear absolutely fine at school, only to completely fall apart at home. And I know many parents find this incredibly confusing. Schools say they've had a wonderful day. Parents think, are we talking about the same child? But there is often a very simple explanation. Home is usually the safest place to fall apart. That does not make the behaviour easy, but it can make it feel less personal. I think becoming a parent has taught me just how easy it is to compare our children with others. Why does my child worry so much? Why does my child struggle with change? Why can't they just give it a go? But comparison rarely helps. Understanding does. And when we understand how our children's brains experience the world, we begin to respond differently, with curiosity, with compassion, and with support. So if I could leave you with one message from this section, it would be this. Neurodivergent children are not choosing to be anxious. Their brains are simply working very hard to keep them safe. And understanding this changes everything. Which brings us to our next spoke, building confidence and coping skills. I think this is the most hopeful spoke on the entire wheel because confidence can grow, coping skills can be learned, and anxiety does not have to define a child's future. Let me know in the chat how many people here can think of something you once found frightening but now do without thinking. Driving, public speaking, starting a new job, learning to swim. Most of us. Confidence rarely appears overnight. Confidence grows through experience. And the same is true for children. I think one of the biggest misconceptions about confidence is that confidence comes first. It doesn't. Bravery comes first. Confidence comes later. Bravery is not the absence of fear. It is moving forward despite fear. I remember meeting one young person who is terrified of sleeping away from home. Sleepovers were completely out of the question. The family worried that this would always be the case. So instead of aiming immediately for a sleepover, we created a confidence ladder. First, spending an hour at a friend's house. Then, staying for tea. Then, staying into the evening. Then, a late finish. Eventually, a sleepover. Small steps, repeated experiences, gradual success, and eventually confidence. I often encourage families to think about anxiety as a ladder rather than a cliff. We're not asking children to leap. We're helping them climb one step at a time. Practical strategies might include breaking challenges into smaller steps, practicing difficult situations in advance, using visual supports, teaching relaxation strategies, developing problem-solving skills, and celebrating effort rather than outcome. I think celebrating bravery is particularly important. Not you weren't worried, but you were worried and you did it anyway. That is courage. I also think it is important that children learn that anxiety itself is not dangerous. Uncomfortable? Yes. Difficult? Absolutely. Dangerous? Usually not. Feelings come. Feelings go. Anxiety rises. Anxiety falls. Children who understand this often become much less frightened of their own emotions. And perhaps the most important message of all is this. Children do not need to become fearless. They need to be confident in their ability to cope. Because confident children are not children who never feel anxious. They are children who know, I can do hard things, I can cope, I will be okay. So if I could leave you with one message from this section, it would be this. Confidence grows through supported experiences, not avoidance, and every small step matters. Which brings us to our final spoke, support and treatment. So let's move on to the final spoke on the anxiety and worry confidence wheel, support and treatment. And I think this may be one of the most important sections of today's talk. Because I know there will be some parents sitting here thinking, we've tried everything. We've reassured, we've encouraged, we've taken small steps, and we're still struggling. If that's you, I want to say something very clearly. You have not failed. Let me know in the chat how many people here have ever worried that you are somehow making your child's anxiety worse. Again, you're not alone. Parenting an anxious child can be incredibly difficult. Watching your child struggle is painful, and there's no prize for struggling alone. Sometimes children need additional support, and that is absolutely okay. Support might come from school, family, friends, parenting programs, support groups, psychological therapies, healthcare professionals or specialist services. I think one of the most important messages I can give parents is this. Seeking support is not a sign of failure. It is a sign of wisdom. Many children benefit from approaches such as parent-led anxiety strategies, cognitive behavioural therapy, school-based support and reasonable adjustments, or interventions that help children gradually face fears and build confidence. Sometimes anxiety occurs alongside ADHD, autism, sleep difficulties, or emotional regulation difficulties. And when we address those areas, anxiety often improves too. For some children with severe or disabling anxiety, medication may also have a role. Medication is never the whole answer, but for some children, it can reduce anxiety sufficiently to allow them to engage with life again, to attend school, to sleep, to socialise, and to learn and to practice the very coping skills we have discussed today. I think it is really important that parents do not view support as weakness, because asking for help is not weakness, it is wisdom. Please remember, anxiety is common. It is treatable, and things can improve. Brains change. Confidence grows. Children develop. Families adapt. And hope matters. So if I could leave you with one message from this section, it would be this. You do not have to do this alone. Support exists. Hope exists, and things can improve. And that brings us to the end of our journey around the anxiety and worry confidence wheel. So as we come towards the end of our time together today, I'd like you to look back at the anxiety and worry confidence wheel one last time. At first glance, it can feel overwhelming. 8 spokes, 8 different aspects of anxiety, 8 possible places to begin. But I don't want you to leave today thinking that you need to fix all 8. You don't. In fact, I'd strongly encourage you not to try. Instead, I'd like you to think about the child you pictured at the beginning. Picture them again. Their face, their smile, their strengths, the things that make them uniquely them. Now look at the wheel. Without overthinking it, point to the spoke that feels most relevant to your family right now. Keep your finger there. That's your starting point. Not 8 spokes, 1. Just 1. Because confidence is not built by trying to eliminate every worry. Confidence is built one small piece at a time. One small step. One brave moment. One supported experience. One difficult conversation. One challenge faced. One success celebrated. That is how families move from chaos to confidence, one spoke at a time. Before you leave today, I'd like to ask you one small favour. Please take out your phone and scan the QR code on the screen. When you scan the code, you'll receive access to my From Worry to Confidence starter pack. Inside, you'll find practical tools designed to help your family get started straight away, including the full anxiety and worry confidence wheel that I use, a worry detective activity sheet, a confidence ladder planner, a step-by-step confidence ladder planner, a reassurance trap guide, how to spot and step out of the loop, a body clues activity sheet, physical symptoms and body clues activity sheet, and a coping skills toolkit, a practical coping skills toolkit. And you can begin using these today. No pressure, no obligation, just support, because anxious families do not need judgment. They need understanding. They need practical tools, and they need hope. One final thought: if you forget everything I said today except one thing, I hope it's this. Anxiety is not attention seeking, it is safety seeking. Anxious children are not trying to make life difficult, they're trying to feel safe. And our job is not to eliminate anxiety. Our job is to help children become confident in their ability to cope with anxiety, because children do not need to become fearless. They need to know, I can do hard things. I can cope. I will be okay. Please be kind to yourselves. Celebrate bravery. Celebrate small steps. Remember that confidence rarely grows in giant leaps. It grows quietly. One challenge faced. One fear overcome. One brave moment at a time. Thank you very much. It has been a privilege to spend this time with you, and I wish you and your family every success on your journey from chaos to confidence. Thank you.